Bone cancer. Bone cancer can start in any bone in the body, yet it most ordinarily influences the pelvis or the long bones in the arms and legs. Bone cancer is uncommon, making up under 1% of all cancers. Truth be told, non-cancerous bone tumors are significantly more typical than cancerous ones. The expression bone cancer does exclude cancers that start somewhere else in the body and spread, metastasize, deep down. All things being equal, those cancers are named for where they started, for example, bosom cancer that has metastasized deep down. A few kinds of bone cancer happen essentially in youngsters, while others influence for the most part grown-ups. Careful evacuation is the most well-known therapy, yet chemotherapy and radiation treatment likewise might be used. The choice to utilize a medical procedure, chemotherapy or radiation treatment depends on the sort of bone cancer being dealt with. Indications. Signs and indications of bone cancer include bone pain, expanding and delicacy close to the influenced territory, debilitated bone, prompting break, weakness, accidental weight reduction. When to see a specialist. Make a meeting with your PCP on the off chance that you or your kid creates bone torment that goes back and forth, turns out to be more awful around evening time, isn't helped by over-the-counter agony relievers. Causes. The reason for most bone cancers is obscure. Few bone cancers have been connected to genetic components, while others are identified with past radiation openness. Sorts of bone cancer. Bone cancers are separated into isolated kinds dependent on the sort of cell where the cancer started. The most widely recognized sorts of bone cancer include Osteosarcoma. Osteosarcoma is the most well-known type of bone cancer. In this tumor, the cancerous cells produce bone. This assortment of bone cancer happens frequently in kids and youthful grown-ups, during the bones of the leg or arm. In uncommon conditions, osteosarcomas can emerge outside of bones, extraskeletal osteosarcomas. Chondrosarcoma. Chondrosarcoma is the second most regular type of bone cancer. In this tumor, the cancerous cells produce ligament. Chondrosarcoma for the most part happens in the pelvis, legs or arms in moderately aged and more seasoned grown-ups. Ewing sarcoma. Ewing sarcoma tumors most normally emerge in the pelvis, legs or arms of kids and youthful grown-ups. Risk factors. It's not satisfactory what causes bone cancer, yet specialists have discovered certain variables are related with an expanded danger, including acquired hereditary disorder. Certain uncommon hereditary disorder went through families increment the danger of bone cancer, including Li-Fraumeni condition and innate retinoblastoma. Paget's illness of bone. Most generally happening in more established grown-ups, Paget's infection of bone can expand the danger of bone cancer growing later. Radiation treatment for cancer. Openness to enormous dosages of radiation, for example, those given during radiation treatment for cancer, expands the danger of bone cancer later on.